Hi everyone, this is Shalu Kumar again from OSCE Nurse Training Cambridge, and I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE Nurse Training Cambridge. I'm back with another adult NMC OSCE video for you, and I really hope so that you are liking these videos. So please press the like button now and subscribe to my channel. And thank you for sending all those lovely comments and all the good news about how you're passing your exam and how these videos are helping you to revise and prepare for your exam. And it's just like a lot of positivities, and it gives me a lot of motivation to keep going and hopefully thinking that I am doing the right thing by making these videos, because hopefully they are really helping you to revise for your exam. So we're back with another adult NMC OSCE video today. So this is actually quite good, I would say. It's really important one. All the videos are important, but this is really important one because I'm going to be covering my 10 top tips. I will cover the first 5 in this, and then there will be a part B to this video next week released. So because otherwise the video is going to be too long. So I am going to give you my 5 first top tips how to prepare, how to do this exam in your exam center on that day, what things you need to be careful about, and what things you should be prioritizing to pass this exam successfully. Okay, your adult NMC OSCE exam. So please listen carefully, because these have been the most common fails in the exam center. I am talking about last 6 months. Okay, these have been the most common reasons for failure in this adult NMC OSCE exam. So listen carefully. They're really going to help you to stay safe on the day and pass this exam, hopefully first time. So let's get started. So let's look at the first one. Stay calm. Okay, you might think, well, that's obvious, you're gonna say that, stay calm. Well, no, actually this is a very, very, very important thing in your exam. I know it's not easy to stay calm because it's a high stake exam. It's hands-on exam. You are getting they're recording you on the camera. You are in a place you never seen before. You are with examiners you never met before. So I understand that. But at the same time, this is the single most important thing which is going to help you to pass your exam, is staying calm. So I have written some pointers on the screen for you, and I'm going to show you what they mean and how you can apply those to stay calm in your exam. First one, order of stations. Now your exam can come in any order. Don't go into exam center thinking my first station will be assessment, or I will do the API first, then move on to clinical skill, then move on to professional value evidence-based practice. That's not always the case. It's only 50% chance you start with API. There is a good 50% chance you start with clinical skills, or you start with professional value or evidence-based practice. So your exam can be started in any order, and the stations can be in any order. Okay, because we hear a lot, nurses going into exam center, they've been asked to do a clinical skill, and they suddenly go, oh my word, I wasn't expecting that, how I'm going to do this, and that's it, the panic sets in already on the first station. The panic starts setting in. So be prepared. You can be asked to do API first, or you can be asked to do clinical skills or professional value and evidence-based practice. So it's not always that your exam will start with API part of the exam. Okay, so that's the first thing to think. Second thing is, listen carefully to the briefing from examiner. It's really, really important that you are listening to your examiner, because they are giving you briefing. They're telling you what has already been done, and your equipment is clean ready, your trays trolley clean ready or not ready, and they're giving you special instructions. So listen very carefully, because that is a very useful information to complete your station. So that's really, really important. If you don't understand something, ask again. Okay, another thing is, next one is check equipment. And if you don't know how to use it, please ask the examiner. Like, say you don't know the blood pressure machine, where is the button for pressing the blood pressure, or you setting up the suction machine for your clinical skill, and you don't know where is the on off button. It might be at the back of the machine. So ask. They're happy to show you that part. They can't help you with the station, but they're happy to show you how the equipment, that particular piece of equipment works. That is only if you ask. If you don't ask, they assume you know it. Okay, so if you're not sure, ask. Okay, that's really, really important, because a lot of panic sets in if you are not sure how. You just look at a piece of equipment, you go, oh God, I've never used this before, how I'm going to use this, and you start panicking already. No, you are allowed to ask, okay? But before your timer start, not in the middle of the station, before your timer start, check your equipment. You're happy, you can see the on off button, you can see the different things that you need from that machine during your station. So already have a look at it, okay? So that's really important. And another thing to think about is, this is quite obviously intense atmosphere to do your exam, and you will try to stay calm, but even then, you know, you may get a little nervous, especially if things don't go to plan and you just getting really, really worried going into your next station. Ask for a few minutes break, okay? Just say, I need a toilet break, or I just need a glass of water, whatever it is. Just get yourself few minutes break, because examiner doesn't know unless you ask that you need to go to the toilet, or you need to just have a drink of water to calm yourself down, okay? So it's really important, because mistakes you already made, you can't do much about it, but it should not affect your other stations, okay? Because every station you pass in this exam, you will not have to do ever again. So that's the principle. So just stay calm and just take a single station at a time, and just think about only that particular station. Try to forget what happened in the previous stations or what is going to happen. Keep worrying, I've got to, oh, if I get this in my next station. Stop that. Just concentrate on one station at a time, and forget what happened. If you're feeling a bit overwhelmed and worried, take a few minute break and come back, okay? So these are the things you can do to stay calm in your exam. Next one is communication. It's really important, because if you don't communicate well, examiner can't hear you well, or examiner can't judge your knowledge and what you're doing, and that would be a fail. So it means, like, verbalize everything clearly. It means you need to make sure that if you're doing drug checks, for example, you're looking at the name of the drug, you're looking at the expiry date, you're looking at the dose, you're looking at that it's the same drug as prescribed drug. You really do need to verbalize everything loudly and clearly. Don't keep doing all these checks in your head. You might be doing it, but examiner can't pass you unless they hear it clearly. Same thing if you're checking somebody's ID, or you're checking something else, or you check taking consent, or anything you're doing. Please keep verbalizing everything clearly, because examiner sometimes is a little bit far away from you, and they are trying to obviously understand your knowledge, and that's why they need to know why you're doing what you're doing, and keep verbalizing everything, that I am doing this now, I'm checking this now, and I'm checking this, and I'm doing this, okay? So it's really, really important that you verbalize everything clearly. A lot of the time misunderstanding happens because examiner don't think you haven't done it. You think in your head you have done it, but you haven't verbalized it, and then the result come back and you go, well, but I did do it. Yes, you did do it, but you did it in your head, you didn't verbalize it. So that's the important thing. Another thing is listen actively to your actor. In assessment station you get a real actor, so listen to the actor, because you know that is your patient and you can't ignore your patient. So listen actively and try to answer the questions as the best as you can, and also to your examiner, like I said, the briefing. Make good eye contact. In assessment station you with the real actor, so make good eye contact. When you're talking to them, look at them, don't look anywhere else and then talk to them. So that is not good, because your examiner will pick on it. Look at the, okay, so in other stations you normally get mannequin. It's only like implementation or assessment you get a real actor. Other most of the station you get a mannequin. So if you're getting a mannequin, then look at the mannequin, not examiner, because examiner will be mannequin's voice, but you should look at the mannequin, because that is who that person, the mannequin is your patient. So you got to be looking at your patient, talking to your patient, and then examiner will be the mannequin's voice, but don't look at the examiner, look at the mannequin. Number 3, correct ID, allergy check and consent. That goes without saying. How many people are failing because they don't do correct ID check? So if your patient is wearing a name band, please look at it, ask your patient the full name, the date of birth, and look and check that is correct on your name bed and is correct in your document, and verbalize as well. Oh, I'm looking is correct on your name bed, I'm looking is correct in my drug chart. Oh, I can see that your date of birth is correct. What is your date of birth? Yes, I can see that's correct on your ID band, and I can see that's correct on my MAR chart. So whatever documentation you're using, but you need to keep verbalizing everything, like I said, and keep checking in real time. Do correct ID check against the correct document. If you been given a document, if you're going to do a ID check, then do it correctly. And also, no ID check is complete without allergy status. Make sure you always checking patient allergy status and the reaction to allergy. So there has been lot of fails on this. Okay, so make sure you do that and verbalize it as well. And then taking valid consent. People forget. Consent is so important. Everything you're doing, just tell your patient quickly what station you are doing and why you're doing it, and just take a valid consent. Okay, whether it's real actor, whether it's manicure, it makes no difference. You got to take valid consent before you go ahead. And if you don't do that, you're not working within NMC guidance as a critical fail, and there has been a lot of fails in the exam center for this. And it applies to all stations, doesn't matter what station, unless it's a written station. Of course, then you're not talking to anyone, but if it's not a written station, please take a clear consent. Number 4, the documentation. Now make this priority. Like in assessment, you're documenting your news charting or GCS charting, or in if you have given drugs in implementation, you are going to sign for the drugs or omitted drugs or given drugs, or if you're giving any other medication or any other, like you've done peak flow, you need to document your readings. You have given inhaler, you need to document that you've given it, you need to sign for if the given drug means. I'm just giving you some examples. So if there is a document in that station, you need to make that your priority. As soon as you've done that task, make sure the first thing you do is document. Okay, clean your hands and document. Because if you haven't given your patient cold bell at the end, or you've forgotten, you haven't got enough time to do your final hand hygiene, you can just verbalize it at the end. I will do my final hand hygiene, but you can't verbalize documentation. So you need to make that priority. Everything else comes after. How many times I see you finish your station, you finish your task, you give an IM injection, you're still talking to the mannequin. I will do this, I stay 20 minutes, I do this, I do this, I do this. No, make your documentation priority, and then if you have time left, do the rest. Okay, but documentation has to be always the priority. Okay, so that's important. Date and sign all your documents, and if you make corrections, remember it's single strike and your initial on the top, and so make corrections within NMC guidance. Moving on to the next one is your stay factual, stay relevant, and stay evidence-based. So whatever you do in your exam, especially in API scenario, if you're saying something, it has to be factual. So say you're writing care plans, and you write a care plan on pain, but your patient didn't have any pain. So that's not factual. Okay, so you can't just write a care plan for pain because you like doing that, you practice that care plan. No, that has to be a real problem for your patient. So that means relevant and factual means it is actually relevant to your scenario and is a real fact for your scenario. And whatever you write in your interventions, or you verbalize your interventions, all have to be evidence-based practice. You can't use homemade interventions. Okay, so everything you say or do has to be evidence-based, or write in your clear plan has to be the current evidence-based practice. So don't forget that. And don't write anything like, say you have a fall and fracture scenario, and your patient is on bed rest because they got hip fracture, and they also got incontinence of urine, and you write in your care plan, to prevent incontinence of urine, I will give regular bedside commode to my patient to empty bladder. But this patient should not be taken out of the bed. So it's not relevant, it's not factual, it's not evidence-based what you're writing. Okay, and it is compromising patient safety. If you take a patient who's got fractured hip out of the bed, that is definitely safety issue. So it would be a critical fail. So just giving you examples. So remember, what you're doing has to be a safe practice, have to be evidence-based, have to be a factual and relevant thing for your scenario. So, okay, everyone. So, you've seen the first five this time, and hopefully, it's making sense. Hopefully, you're understanding what I'm saying and why I'm saying it. Why is it important to pay attention to those points and not make those mistakes? So, I hope you like the video, and if you do, please press the like button now and subscribe. I am going to be back with part 2 soon. Next week, it will be released within 7 days, and you can see the next top 10 tips. Like I said, I didn't put everything in one because it will be too long. The video will be too long, so that would be the next video coming up soon. So if you want to have more information about our training, you can visit our website, which is oscinustraining.com, or you can email us on oscinustraining@outlook.com. We provide both online and face-to-face training, so you can get some more information about that. And I will soon be back with another video for you. And don't forget to check the Google Google advertisement page for us and see what the nurses been saying who have had training already. Okay, I will see you soon with next 5 top tips next week. Okay, thank you and bye for now.